Welcome. Welcome, my dear friends. Myself, Professor Dr. Rajendra Deshpande from Pune, Maharashtra State, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know that I am MD in Ayurvedic medicine and MD in Ayurvedic physiology. For paid online consultation, you can definitely WhatsApp on 9226810 My dear friends, today's topic will be interesting for the diabetes patients or the relatives of the diabetes patient because today we are going to discuss in this video diabetes diet plan for the Indians. Diabetes diet plan for the Indians. Here we are going to see which foods are better, which foods are not good, which foods should be avoided by the diabetic patients. Today's video is super important for every Indian battling with diabetes mellitus, especially type 2 diabetes mellitus. We will break down the ideal diet, the right lifestyle, and how to manage your blood sugar with the help of both allopathy and Ayurveda. Stay with me till the end because we will also talk about what foods to eat less, what food to eat in moderation, and which type of the food should be avoided completely. My dear friends, diabetes is rising fast in India, especially because of sedentary lifestyle and poor eating habits. This is a condition, diabetes mellitus, where your blood sugar levels become too high due to lack of insulin or insulin resistance. If your blood sugar is not unmanaged, that is, uncontrolled diabetes can affect your heart, your kidneys, your eyes, your nerves, and more than that. For example, uncontrolled diabetes can give diabetic nephropathy. Uncontrolled diabetes can give diabetic retinopathy, and the person can become blind. Uncontrolled diabetes can give the diabetic neuropathy. Then nerves will be damaged, tingling, numbness, complaints will start. My dear friends, if we are very cautious about our diet chart for diabetes, the patient can improve the blood glucose control. The patient can reduce the risk complications. Patient can maintain a healthy weight and patient may decrease the medication requirement. That means the medicine dose will be reduced, insulin can go off. My dear friends, key nutrients for a diabetic patients. Next, we will see the list of these essential components of diabetic friendly diet. First proximal principle of food is carbohydrate. Carbohydrates affect the blood sugar more than proteins and fats. However, not all carbs are the same. Carbs include other type of food like complex carbohydrates found in the whole grains, legumes, and some vegetables with fiber. They are slowly digested, and that is why they are leading to a gradual sugar spike. Common sources are simple carbohydrates, which are bad carbs, like, for example, white bread, sugary snacks, or soft drinks, which can rapidly spike the blood sugar level. We are continuing with the key nutrients for a diabetic patient. Protein. Protein is important for tissue growth. Protein also provide energy and repair muscles, which keeps you satisfied longer. Proteins don't increase the blood sugar aggressively. However, carbohydrates can help moderate blood glucose levels. Fats are necessary for overall health, and one must select the appropriate fat. Good fats are the mono-unsaturated and polyunsaturated types found in the nuts, seeds, avocados, and fatty fish. I repeat, good fats are mono-unsaturated and polyunsaturated types found in nuts, seeds, avocados, and fatty fish. Vitamins and minerals are important to control diabetes. Diabetic patients will need chromium, magnesium, vitamin D, and B complex. Now we will start to check which foods should be avoided completely by the diabetic patients. Say no to these foods. White rice, no. Maida or the refined flour, no. Sugar and sweets like in India, laddu, rasagalla, jalebi, no. Cold drinks, packed fruit juices, no. Potatoes, especially fried potatoes, no. Bakery items like biscuits, cakes, and pastries, say no. Excessive red meat, no, not at all. Kindly note, you must check the food labels. Hidden sugars are everywhere. Now, foods that can be taken in moderation for the diabetic patients. Whole wheat chapati, 1 to 2 maximum per meal. Fruits like mango, banana, grapes, very small amount only, very small portion. Pulses, great, but do not overeat the pulses. Milk and curd, choose the low fat versions of the milk and curd. Homemade ghee, 1 teaspoonful per day maximum. Now, foods that can be taken from little amount to the moderate amount, and they can be taken regularly like millets with the ragi, jawar, and bajra, brown rice in small portion, leafy vegetables like spinach, methi, and coriander, bitter gourd like karela, Indian gooseberry that is amla, and turmeric are good. In nuts and seeds, almonds, walnuts, these are okay. High fiber veggies like lauki, tinda, bhindi, and torai. Cinnamon, methi seeds like fenugreek, and curry leaves are also okay for the diabetic patients. I request all the diabetic patients that they should focus on controlling sugar with medicines as prescribed by your family physician or diabetologist like metformin, DPP4 inhibitors, insulin if needed. Diabetic patient must do the regular blood test like HbA1c every after 3 months. Whether you take allopathy, whether you take Ayurveda, whether you take homeopathy, whether you take the naturopathy, but HbA1c blood test is mandatory and must be done by each and every patient of the diabetes because this test gives you the average blood sugar in last 3 months. Lifestyle modification is a key to control your diabetes. Exercise and diet together can very well control your diabetes. Avoid skipping medications or self adjustment of the doses is not allowed or is not recommended. Always consult your diabetologist before changing any medicines. Next, diabetes is known as Madhumeha in Ayurveda. Ayurveda focuses on cleansing your body, detox, balancing vata, pitta, and kapha, and strengthening the digestion. We, Ayurvedic doctor, use such type of the herbs to treat the diabetes. Like for example, Gudmar. Gudmar is a medicinal herb. Is called as a sugar destroyer. Interesting thing about the Gudmar, I would like to add. For example, if you chew the Gudmar leaf and then you take the jaggery or the sugar in your mouth, you will not feel sugar or the jaggery as a sweet taste. See the effect even if you take the Gudmar leaf in your mouth and bite it, chew it, and then take the sugary components, sugary food, you will not feel the sweet taste of that particular sugary element. Then we use the methi seeds, soak overnight, and one can drink the water soaked with methi seeds. Karela juice is also available in the market, or you can make a fresh one. You can take it on the empty stomach. Amla is rich in vitamin C and it also supports the pancreas where the insulin is manufactured. In Ayurveda, Panchakarma therapies, that is detox process like Vamana, therapeutic vomiting, we are always advocating for the diabetic patient for the long-term management or long-term control to blood sugar. Ayurvedic powders like Nishamalaki Churna, Vijayasar, and Jamun seed powder are often recommended. Caution: Ayurvedic remedies must be personalized. Tailor made treatment is Ayurveda. Avoid self medication. For the diabetic patient, good lifestyle habits: 30 to 40 minutes daily brisk walk and also the yoga postures. Early dinner before 8 p.m. Adequate sleep of minimum 7 to 8 hours. If at all there is a stress, then stress management is essential to control your blood sugar. You can do it with meditation or pranayam, that is breathing exercises. Regular medical checkup is also one of the important steps to be followed by the diabetic patient. And what can be your bad lifestyle habits? Late night eating is bad. Skipping meals or binge eating is bad. Sitting for long hours, that is a desk jobs, sedentary lifestyle is bad to control your blood sugar. Smoking and alcohol can problematic to control your blood sugar. High screen time and less physical activity is like an enemy of your diabetes. Now, managing diabetes is not about cutting everything from your life. It is about living smarter and healthier. Small steps like switching from white rice to the millets or adding a morning walk to your routine, daily routine, can create big changes in your life. Your quality of life will be definitely improved. Whether you follow allopathy or Ayurveda, discipline and consistency is what brings the results. If you found this video helpful, give it a like, share, and someone who has a diabetes, you please share this video to these your friends and relatives. Subscribe for more such health tips in Hindi, English, and Marathi because subtitles and dubbing is available for my channel. Thank you very much. Stay healthy, stay happy. See you in the next video with a new interesting topic. Take care and God bless you. Thank you very much. So, thank you very much and take care. All the best.